Hi, my name is Leslie Hammer, and I'm the co-director of the OSU Healthy Workforce Center. I'm also a professor of psychology and an associate director of the Occupational Health Psychology program at Portland State University, and I've had over 30 years of experience researching work-life, work-family issues. I approach these issues from both the occupational health psychology and total worker health perspective. And what I do is really think about the work-family interface and how it intersects with individual factors as well as work environment factors to impact health and safety of workers. And then I integrate that with the approach of total worker health, which is defined as policies and programs and practices that integrate protection from worker-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. So total worker health and occupational health psychology is really important to prevention, and that's the approach that I take. Prevention is key. And I take this prevention focus from a systems perspective, where prevention really needs to focus on both individual risk factors as well as occupational risk factors when understanding ways of reducing work-life stress. So work-life stress has to do with this difficulty in integrating work and non-work, work and home. And it is one of the most significant stressors in the workforce, and it is viewed as an occupational hazard by a number of factors. So key psychosocial stressors have been identified as being critical to impacting and contributing to work-life stress. And those key psychosocial factors include things such as high job demands, high levels of job stress, an unsupportive work-family culture, and an unsupportive supervisor. Furthermore, job insecurity contributes to work-life stress, as well as poor work schedules, low autonomy. And what we see are adverse outcomes associated with work-life stress. And these are adverse outcomes at home, as well as at work, as well as adverse outcomes on individual employees' health. So it is critical for workplaces to understand that the work-family integration and the work-family stress has a significant impact on all aspects of our lives. Furthermore, the costs of stress are enormous. Healthcare expenditures are nearly 50% greater for workers who report high levels of stress. And so understanding the changing nature of work, and as we know, with most recently with COVID and how our work has changed significantly, whether people are in jobs that are require them to be on the job as essential workers, or if they are required to work from home as remote workers and caring for children, aging parents, while they are still having to work full-time and not miss a beat. And the nature of the Future of Work initiative that NIOSH has advocated really addresses workplace, work, and workforce factors that are related to work, non-work stress. So, for example, work arrangements are important to how individuals are able to integrate work and non-work. And so, for example, the requirement to be a remote worker full-time has been difficult for many people when their children are home full-time and they're trying to teach their children school and also work full-time. Furthermore, work technologies and the type of work that we do. So whether it's very intensive, stressful work, or if it's high vigilance work, that leads to high levels of stress, which can impact our overall life stress. And then finally, the workforce and demographic variables, such as aging workers. And we're going to see more and more aging workers, and we need to develop and identify ways to support such workers in the workplace. So solutions, what are some solutions? What are workplaces do? Two primary levers to identify and to address are increasing control over work and supervisor support, which is what I do and what I've done in my work, is address supervisor support, which leads to a number of improvements in well-being of workers. And finally, I have 4 facets of family supportive supervisor behaviors that I train supervisors on, and I've seen improvements in safety, health, and well-being. Thank you.